So these are my financial interests. So when you look at the 10 commandments of a good LASIK or a lenticle-based procedures, it starts with a robust diagnosis and how we build in a good skill transfer, especially with this modern day newer procedures, and how you symbiosis between the machines and diagnostics. So most of it has already been discussed by different platforms, so I'll not go too deep into this. See, it's always about the spots. When we started looking at the Zeiss, when we started using them, we were never really interested in the spot sizing, the laser energies, and all the other optical parameters. But over time now, we have realized that this has a huge fundamental role in your quality of vision. Every machine has its own unique energies. They have their own spot sizing, the speed, and all this has an impact on your quality of vision. This is what Dr. Sri Ganesh was talking about. It is every energy has a different on features on your confocal microscopy, and that shows up as a poor OSI, what has been described. The shapes of the lenticules, we may debate about how it has an impact, but as we keep moving forward, these shapes will have a huge impact in trying to customize the LASIKs. They will try to help in maybe a presbyopic way of how you're doing the procedures. But the challenge still is about the patient expectations and also about the realistic expectations and surgeon related factors about the way you dissect. And many times people tell me, this is my first, I'm buying a new Silk or Smile machines. And what they try to do is they start with the first VIP patient they get who's been waiting for this. And this is what you end up with. So I tell them that at least you reach some level of plateau where you're trying to, when you're trying to be optimal with your settings, then you start operating on all these people. Because at this stage, you end up in your whole body language and you become completely disillusioned with the systems. And this is the kind of optimization we can achieve today with lasers. I'm sure all the platforms are able to achieve this kind of minimal dissection removal of lenticules. The connecting to diagnostics is a huge leap. We have seen how Zemer is connected to the Galilais, IOL Masters, MS39 to Schwind et al. And multiple other platforms. I'll skip these things which has already been discussed by Dr. Sri Ganesh. These are few things which I want to highlight on what is important. The question always comes is, now we are looking at the Wavelight Plus, and Wavelight Plus, wise, whatever you call it, has shown that there is a definitely more improvement in the lines of vision. Whether it translates to improvement in the quality is something which we have to see. So machines today, whether the platforms you use, are trying to bring in a much more regular control of higher order aberrations. This is what we published with Silk, where the higher order aberrations with profiling and laser energies are much more well controlled. Predicting outcome is still a way to move forward, and you still have these challenges with the wow effects here, even though you have a crystal clear corneas. And few of it, what Dr. Ganesh mentioned about the age factor, the hydration factors. So when you look at the future, you start looking deeply into the whole collagen structures itself. And when we started looking at the collagen structures, which is at this point of time, we can image it using the polarization OCT, because the cornea has birefringence. The stroma doesn't have a birefringence, so that when you use one polarized light, polarized filters to it, unlike the OCTs where you use mix of multiple lights. So what happens is a cornea, which is like this here, which has a more stronger collagen compared to the weaker collagen, the lighter colors of blue, and which has a different extracellular matrix, behaves differently. And this is what I would take a minute to explain what Sheetal asked a question to Sir Sri Ganesh sir about why the faster was better why there is a more forgiving black spots is because when you have a faster laser, you leave lesser intraocular pressure time duration, and the lesser intraocular pressure time creates less of fluid ingress and TGF beta pathways. The TGF beta, if it comes there, is like a one which blocks a lot of structure. So she's right according to me, because When you don't have it in your cornea, that means you are faster. So IOP is a very, very big factor in the new generation procedures. And you can see here, the stronger eyes have a tougher dissection, and compared to the eyes which is here, which is completely different. So next generation of machines should be really looking at the integrating the biomechanics, and people are working on it. There are already, we worked on the simulation, mathematical simulation. At least 2 companies are very keen to integrate it into their software, that you don't need to keep adjusting your energies. What works here is very interesting in this zone out here is you already have an Young's modulus. Most of the laser energy is based on Young's modulus, and it gives you Young's modulus even before you actually treat the patient, and you know exactly where your cornea is. This is not biomechanics, this is mathematical modeling, and this is something which we have developed in-house. It has its own AI. Now companies want to integrate it so that your energy setting is not one spot. You can choose based on your modeling effect. Now they have a modeling in all their machines, but it's not primed to the patient, but this is going to be more customized. Finally, it's all about the biology, because you change the corneal nerves, you induce myofibroblast. This is what Dr. Sheetal, this happens. More of TGF beta is more of intraocular pressure. So that is what blocks, and that's why when you have less of intraocular pressure, you probably are right. And I've been using this AIOS barometer, which gives you ray tracing of every layer of your cornea. I'm very excited with this new technology because it gives you a ray tracing map of the corneas. Why is it important is, it gives you at one stretch. It's not epithelial thickness map. It is epithelial refractive ray tracing map. And this is something which is important is, we can see that sometimes if you have a dry eye patient like this, you can end up in having a lot of epithelial ray tracing irregularity, which is making him to be, which is what we need to avoid in any refractive procedure. And this is what he had, a poor corneal nerves and a lot of inflammation. Every spot has a biology in it. Your spot is in between spots has a biology hidden in it. So every time you have a dissection which is tougher, the spots behaves completely differently, and there is a pathways of each. And what you see is probably hidden in your confocal microscopy. A bad spots, every spots create this kind of a picture which causes the scatter. So going low is important. And most important thing is today is about the nerve. It's not just dry eye, it's about healing of the nerves. And it's important that we need to take care of how the corneal nerves heals. The diagnostics of future will be a point of care diagnostic like FNAC. You take it out in 30 minutes, you get whether your cornea has weak collagen, then you decide on the spot whether you need to do a cross-linking or not. But this is the future, how to get better dissection, collagen disturbance, laser energies creating less activation, and trying to work on the energy settings and biomechanics. Thank you.
Thank you so much, Dr. Rohit. I think what you do is so unique, and it is really taking the science forward. If there is one quick question we can get, or we can go to the next one.
We'll come again.
We'll come again, yeah, sure.